Objective 8, apply knowledge of principles and evidence-based practices for assessing reading development. So Objective 8 is going to be all about reading assessment. So we've talked a lot about how reading works and how instructional evidence-based practices, what those are across all the different areas of reading. But now we need to talk about, okay, how do we assess that a student is making progress when we are implementing those evidence-based practices? So that's what Objective 8 is going to be all about. The point of assessment essentially comes down to this question: how good are our decisions? What assessment is designed to do is to inform the decisions we make with some level of objectivity so that we can make the best decisions possible. And we're not just relying on our biases and intuitions and observations, which might be limited, to make instructional decisions. We're trying to make them as data-based as possible, right? We want to do data-based decision making. So we use assessment to provide evidence for our decisions. So if I make a claim about a student and I say, this student struggles at decoding, okay. And if I'm sitting across from, a parent or another teacher, they might say, oh, that student struggles at decoding? How do you know that? Well, the answer to how do I know that is often going to be some sort of assessment data, right? They struggle at decoding because when I gave them this test of 20 closed syllable words, they only got two of them right. So we did a little assessment to see how they should be doing, and they didn't do very well. So that's our evidence that they're struggling decoding compared to someone, compared to their classmates, compared to other things, or even compared to themselves, right? They're not progressing as quickly as we'd like them to. So it becomes really important that if we're going to make decisions for our students, and some of these decisions can be really big and important, and others are just sort of day-to-day decisions, we want our evidence to be high quality. And when we say we want high quality evidence, that means we're going to use tests. So that begs the question, what makes a test good? Good evidence comes from good tests. What makes a test good? So we have two things that we look at, and the MTEL is going to 100% ask you about. Almost certainly the MTEL is going to ask you about these two things. The first is reliability. Reliability is a property or quality of a test score that refers to how consistent the test score is. So if I give this test to a student and I give them the same test a day later, I would want, and I didn't do any instruction between then, I would hope that their performance on the test would be, if not the same, then very, very close, right? So the consistency of the score to replicate itself is what's called reliability. So if I give the kid a different test across time points, how likely? If I give the test and you give the test, is there a difference between the scores, right? And that could be a way that the test is given. Right? If there's a lot of ways that you can maybe emphasize different words when you're giving instructions, or it's not specific about what tools the student can use during the test to aid them. And when I give them the test and somebody else gives them the test, we have different rules about how to give the test. So then the student has a really different performance based on who was giving them the test. That shouldn't be the case, right? That's not reliable. That means that we're going to get really messed up data, and either we're going to think the student is doing way better than they are, or the student is really struggling when they really aren't. And both of those are bad. We want accurate data. Um, Yeah, and within the test should be accurate. So if the test is all testing the same thing, like the items should be, you know, uh, comparable to each other so that the student isn't like, if they only took one part of the test, they're getting this wildly different score versus this other part of the test. All of these things feed into reliability. You will need to, the MTEL is going to ask you to define reliability at some point. I almost guarantee it. And there's actually very limited ways to ask the question on reliability. So when I show you the reliability question in a second, I would expect the question on the MTEL to be almost exactly the same because it's really hard to um, change up the question too much because reliability is what it is. All right, reliability is one side of the coin. The flip side of this coin for assessment in answering the question, what makes a test good, is, oh, I have a whole other slide on reliability. Um, Again, reliability is one piece that is very important for the test. It helps you determine whether you should select the test. It is a quality of the test score, and it is necessary but not sufficient because the other piece. So we have reliability. Now the other piece is validity. Validity is the degree to which the test, um, the technical way to say it is, which the inferences derived using the test scores will be accurate, right? And the simple way to say this is, does the test claim what it measures to claim? So if this test is a test of reading comprehension, if that test had validity, it would show up in other places and compared to other tests of reading comprehension, right? So I wouldn't want my test of reading comprehension score to be wildly different than another test of reading comprehension score. My some of my validity in my assessment for reading comprehension is derived from the fact that it matches up with other tests of reading comprehension, right? Other ways we can derive validity is from how the student's performance is in the classroom. If I give a student a test of reading comprehension and their performance in the test is not matching up with their performance in the classroom, like it's wildly different. Like either they did really good on my test and they're really struggling in class, or vice versa. Um, they did poorly on the test, but they're fine in class, right? That might mean that the test itself is not good. And the way in which it's not good is it lacks validity. So validity is a property of how we interpret the scores, right? It's not a quality of the test or necessarily the scores, but it's, how good is our decision making. So is our decisions about the test valid? Right. So we have these two coins, these two sides, reliability and validity. In reality, reliability is a part of validity, but for the purposes of the MTEL, just know that we have reliability versus and validity, and you're going to need to be able to know what they are. Okay. Again, the point of assessment is that we want to know uh, the the importance of doing assessment is to help us make decisions, right? So are the test scores useful for making instructional choices about the test? Does the student need a little more decoding practice? Does the student need a little more vocabulary practice? Or are we confirming that the student is having a successful intervention, stated positively, right? So we have all of these things to review whether the tests will be useful to us in decision making. The MTEL might also ask you when you're in terms of decision making, it might ask you about interpreting test scores or test score interpretations. There are two main ways that the MTEL might ask you about how to interpret test scores. The first is what's called a normative reference, or a norm reference for short. A norm reference is an interpretation made of a score by comparing that student's score to a whole big sample of students that took the test, right? And so we developed this thing called a normal curve. And so if you've ever heard of something where we say the student is in the 65th percentile of reading comprehension for fourth grade, for their grade level, right? That saying they're in the 64th percentile is what's called a normative reference. The 64th percentile means that they scored better than 64% of the kids that took the test, right? And worse than 36% of kids that took the test. That means that when I say that, you are, okay, is the student struggling with decoding? No. What's your evidence? My evidence is on this norm reference test of decoding, that student scored in the 64th percentile. That is my evidence that compared to other students, they're perfectly within the average range. And my evidence that they don't need more decoding practice is made by my interpretation of that score. That's normative reference, comparing to other students, usually of the same grade. The other reference you might hear is called criterion reference. And if you've ever looked at a table of data like this before, where students are highlighted in green, and yellow, and red, and you're looking at a bunch of numbers that you can't really make sense of unless you know the test, because they're what's called raw scores, right? That they're not really interpretable unless you have some sort of criteria or benchmark to which you're comparing the student. So I can't derive how a student is doing. I can't make a judgment about a student's performance unless I set some sort of benchmark to compare it against. So let's just say this is math, a score. Oh, here they are. Letter name fluency, right? So we have letter name fluency for the fall, and we have students get 22 words per minute, 24 words per minute. Oh, and then the student in yellow is 7, and then these students in red are 0, 1, 0, 0, right? So what does that tell me? That tells me that in 60 seconds, these students named almost all of their letters, and then the students in red named almost none, and then the students in yellow named a concerningly few amount. Okay, where do I derive that concern from? How do I know that this student in yellow, how do I know 7 isn't good for this student? And I would highlight it yellow. I know because I have a benchmark. I have a criteria from which I'm comparing the 7. My expectation is that students would be at green is 9. So all you had to get to green here in the fall was 9. I'm assuming this is fall kindergarten. So my criteria was that if you had 9 letter names in this letter name fluency test, then I'm not concerned about you. But if you had less than 9, I'm a little worried about you. And if you had either a 0 or 1, then I'm super worried, and we need to probably start doing some sort of intervention now. That is, all of those numbers are based on a criteria. I'm comparing the student's raw score, their performance on the assessment, to a criteria. I'm not comparing them to all the people that took the test in the normative sample. I'm just comparing to a criteria that I set and predetermined. So if I'm saying percentile rank or something like standard score, I'm making what's called a normative reference, or I say a grade equivalent. They are reading like a, at a second grade level. If I say like at a second grade level, then I'm probably making a normative reference. At least I hope. And if I'm saying like the student is a little bit behind compared to their compared to this benchmark, then I'm making a criterion reference. My interpretation of their score is against a criterion. All right, let's look at some questions that relate directly to assessment and don't have much overlap in the other reading areas. So I'm going to have us do 81 and 82. They're kind of a pair, a question pair. So we'll talk about them both. So go ahead, answer 81 and answer 82, and pause here. The correct answer is B, whether the test questions effectively measure their specified content. All right, so 81 here is asking us what is validity? And if I rephrase what I told you validity is, which is does the test measure what it says it's supposed to measure? That is, does it effectively measure the specified content, right? But let's look at the other ones to just establish what those are as well, because they'll help us probably with other questions if we get these answers straight. So what is A? Examining how a examinee's performance relates to a pre-established standard. That is, of course, criterion reference, which you just saw right here. C, how the particular examinee's test performance compares to other examinees. That's the normative reference. D, whether the test results are likely to be repeatable. Why, that is, of course, reliability. So here we can get practice. If you're getting mixed up with these terms, they're all here. These are all how the MTEL is defining those. Again, A is criterion reference, B is validity, C is normative reference, and D is reliability. So now 82, the correct answer is C, gives fluctuating scores in different administrations. So if a test is not reliable, this is sort of a negative question, unfortunately. If a test is not reliable, it gives fluctuating scores because what is reliability? Reliability is whether it's consistent and repeatable. That's what reliability is in a test, right? So if A, these are all the negative versions, A is not measuring what's supposed to measure, that means it's lacking validity, not reliability. A would be lacking validity. B has not proven to be a useful instructional intervention. That's not necessarily reliability. That has to do with evaluating whether it's an evidence-based practice, right? That's probably it lacks evidence for practice. And D has poor predictive value. That is kind of a piece that can go into validity as well, but it is certainly not related to reliability. Okay, I think that's all I have for Objective 8. So I'm going to continue on in this video and go right into Objective 9. Objective 9, apply knowledge of principles and evidence-based practices of reading instruction. So Objective 8 and Objective 9 are both somewhat more complicated topics related to reading. I mean, this whole thing is complicated, but I'm not going to put a huge emphasis on reviewing questions for both Objectives 8 and 9, because if you remember all the way back to the intro video, many hours of videos ago, that Objectives 8 and 9 are very low weighted. Like there's not going to be a lot of questions on Objective 8 and 9. When you're getting questions about reliability and validity, you're coming to the end of the test or the end of the multiple choice section. And there's just not going to be a lot. So it's kind of, you have to choose very carefully what I want you to study, because there could be a lot of things covered in both Objectives 8 and 9 that are not hard to predict. And there's going to be very few questions on them if you fully explain. So we're not covering everything in Objective 8 that could possibly have been related to assessment. I'm hitting the things that I know I'm very confident that will be in Objective 8. And similarly with Objective 9, right? All these best practices of reading instruction. I mean, that could be its own entire 4-hour webinar. Best practices on reading instruction. So I have to choose carefully what I think the test might cover, and just know that there's only going to be a handful of questions in Objective 9, like probably less than 10. So I'm going to give you some bang for your buck and start with talking about multi-tiered systems of support. This is something you may have seen before. So multi-tiered systems of support is a way to organize how resources are delivered to students. Okay, and I'm going to start with here. This triangle, you can see that this triangle down here, we call this Tier 1. And this represents 80 to 90% of students. So the vast, vast, vast majority of students are going to be in here because they do not have a serious academic or behavioral um, concern. So this is what we do for all students. Might be called general curriculum. This might be called tier one instruction. If you are calling it those things, that's because you are talking within a multi-tiered system of support. So what you need to know is that it goes with all students and all settings, and it's designed for prevention, right? We actually steal this from nursing, believe it or not, or this whole structure in the tier system. So this is for prevention so students don't have an issue. Then we have a series of services that are what we call tier two. And these are targeted interventions, and you're usually for small groups of students, and it's designed to target those specific deficits. So if you see a couple kids at the back of the room at a rainbow table or something, they're probably receiving tier two, right? And this only represents between 5 and 15. I always like to think of this in terms of like a 20 kid class. Each kid represents, um, 5% or something. So here you're talking about 16 to 18 students in a 20 kid class. Here you're talking about 1 to 3 students in a 20 kid class. We'll be getting some sort of small group instruction. And then here we're talking about 1 or 2 students, and this is tier 3. Tier 3 is when students are on individual intervention plans. May or may not be in IEP and may or may not be in special ed. Certainly much more likely to be in special ed, but not necessarily. This is not, you don't have to have an IEP to receive tier 3 services. You can have individual intervention plans that go outside of the special ed system. Obviously, these are very high intensity, and they are students that have severe concerns in either behavior or academics. So the reason we have multi-tiered systems of support is that it's a combination of 2 different systems. One is called RTI, and RTI strictly talk about the academic side of things. And another, which I'm choosing not to have a slide of because I don't think it's going to come up in this MTEL, is PBIS, and that's the behavior side of things, right? So we have both of these. We have an academic piece and a behavior piece. The academic piece is obviously much more relevant to this MTEL, so we'll focus on that. But the reason we talk about them together is multi-tiered system support, and also there's like really good evidence around behavior and academics being like really closely tied to each other, and it's hard. You have to do some investigating as to is behaviors causing the academic issues, and vice versa. So we have all these integrated multi-tiered systems of behavior and academics. So for the MTEL, it might ask you about RTI or response to intervention. And I know for a fact it will say MTSS, multi-tiered systems of support. I would say it's very likely that you're going to get questions on those. So what are, you've allocated your resources in that tiered model. Okay. And so what do you need to do to make sure that students are in appropriate resources? Well, you need to have some sort of assessment, which we talked about. And you need to be using evidence-based practices. So here are there's a lot you could talk about in RTI, but I've tried to get it down to just the things I think are likely to show up on the MTEL. So what do you need to do in RTI? You need, when you're doing the interventions with the student at either tier 1 or tier 2 or tier 3, you're implementing research validated practices, okay? And then when you have students in tiers 2 or tier 3, you're going to be doing more frequent progress monitoring. You're monitoring their growth frequently over time. Everyone is monitored during a universal screening or universal benchmarking, right? This is when everybody goes into the cafeteria and that reads a page for a minute or something. That's universal screening. That's also a part of RTI, and that's what everybody gets. But then between those fall, winter, and spring benchmarking periods, we are going to be taking those tier two students receiving tier two and tier three instruction and very closely monitoring their growth. Okay. And that's called progress monitoring. Okay. So what we want to do is give them evidence-based instruction and monitor their growth using reliable and valid assessments. If the interventions are designed and implemented well, and the student responds to the intervention, right? That's the goal. RTI, response to intervention. We want the student to respond to the intervention. We want to make it likely that they respond by using an evidence-based practice, and we want to be aware that they're responding by monitoring their progress. Okay, that's the big things I want to touch on that are going to be covered. Let's get into some questions related to this. These are both across objectives 8 and 9, but I put them here because it's helpful to have that MTSS background to answer these. All right, so 79, pause here. The correct answer is C, improving reading accuracy by attending to all parts of the word. Okay, so I put this here because this is like what it feels like for a student to be in that tier two, right? So we're having the student, we're monitoring her progress in reading, and we're looking closely at the kinds of errors that she's making. So this is very applied, right? This is a very applied question because you have to attend carefully to what is the mistake that she's making. So the mistake Julie's making is she's reading over tired when the word was overturned, and she read disappoint instead of disappear. But we notice we have this pauses of reading because what does she do? She self-corrects each time. So she reads this, she's attending to the first part of the word and missing the second part of the word, right? This is overtired, right? This is a compound word with a suffix at the end. Or sorry, just a compound word. Tired. Ed is not a suffix in this word. Tired is a whole word. Oh, no, wait. Tired is wow, that's true. Tired is a suffix, isn't it? Right? Tire. You just never hear the word tire as much as you hear the word tired. So sorry, yes, this is a compound word, over tire with a suffix ed at the end, and she's missing the second part of the compound word in the suffix, and then she has to self-correct and redo it. Same thing with disappoint. Disappoint is here's your root word with your prefix here, and they say the first part, they say the prefix right, and then have to self-correct and reread the root word. Right. So what's the problem here? The student is not attending to all parts of the word. And then we would do some sort of intervention using a finger, using a tracker, whatever. That could come up in the essay where you are trying to help them do that, but that is the issue. So A is something we talked about to help comprehension, but how do I know that she doesn't need to develop the ability to self-monitor? Because she's self-correcting, right? Self-correcting is my evidence that she is already self-monitoring and I don't need to work on that. And then for B and D, these are also things that we don't have any evidence of being concerned about. All right, 89. I just wanted to show a question like 89. So the MTEL will sometimes give you a series of information in either profiles of students or maybe some sort of work that a student's completed, and then ask you a couple questions about that. And this is one of those. So in the practice test, there will be these profiles, and then there's a couple questions about the profile. So here I pulled the profiles and just pulled one question. So let's review the profiles really quick, and then you can pause to answer the question. So profile 1 is we have a student that's reading words accurately, but not understanding them. Profile 2 is we have a student that understands and has a lot of background knowledge and comprehension skills, word reading, but they can't decode. So They're like the opposite, right? This student decodes but doesn't know what they read. This student knows a lot of words but can't sound them out and decode. And then profile three is the student that needs help in both. All right, now try to answer 89 on your own. Pause here. The correct answer is C, selecting assessment instruments or techniques that will show even small improvements. So, I gave you all that about the profiles, and the MTEL is going to do this to you. It's going to give you sometimes a lot of information that's not relevant, right? So, all of that information about the differences of the students is not actually relevant to this question. It may have been very important for other questions, but it's kind of a trick or throwing you off a little bit, right? You have to pay attention carefully because the differentiation between the profiles of students is not relevant to this question. What you need to know to answer this question is that selecting an assessment instrument that is sensitive to growth, right? That shows small improvements. So I talk about sensitivity a lot. Um, the instrument, the assessment is sensitive so that when a student actually gets better, that the assessment we chose shows that they've gotten better. That means it'll show small improvements, and that means that the assessment's sensitive to their growth. We can sometimes choose an instrument that is far too hard for the student, in which case they could be making progress and they still wouldn't be showing any improvement, or the opposite, which is we choose an assessment that's way too easy for them. And so they've kind of hit the ceiling on the assessment and we're not showing growth that way either. That's the most important thing for progress monitoring, right? Um, a, we that it's nice to provide students with positive reinforcement about their strengths, but we have to be very time efficient. Teachers are very time poor, and so that's not true. We're going to be monitoring students' weak skills far more than their strong skills because we have to take time, right? Time spent assessing is time not spent in instruction. So we have to be very careful with the time we choose for assessment. And so we're going to spend that on helping them with their weak skills. Of course, using standardized norm assessment instruments is helpful, but sometimes those aren't available. And when we're just making these little we're making smaller scale instructional decisions as opposed to like big IEP placement decisions, something like that. We it's fine. It's not the most important thing to be using a norm referenced assessment. Those are often bigger. Sometimes you can't even use them frequently because there has to be big gaps between when you give them. So that's definitely not the most important thing. And D is, you can do group administered assessments. There are examples of totally valid and reliable group administered assessments. However, that's not the most important thing that's going to help the student make decisions. It's picking the assessment that's sensitive to growth. All right, 93, pause here. The correct answer is B, adjusting instruction for individual students according to their responses to the intervention, right? So this is all about MTSS and how it's going. So you get a ton of information about the teacher and the several times a week and blah, blah, blah. And all of that, it's tier two, right? So I told you that tier two is that middle group, that small group instruction, and they have strengths, but that's not what the question is. The question is, what's a key principle of MTSS? Okay. So the key principle of MTSS, and you can see it here. If you just remembered that I told you that RTI is the academic side of MTSS, then you would see response to intervention right in this question, and then you'd be like, yep, responses to intervention, that sounds like MTSS, and you'd go with that one. A is providing materials written at the most accessible level for students. That's nice, but not a part of principle of MTSS. Changing materials and resources frequently as student interest is not a key principle of MTSS. And D, following a scripted program for beta. You can tell, so we do often want you to follow scripted intervention programs, so to take the burden of planning off of you. But you can tell that they had to add this extra word verbatim, which means that you just read it and you don't pay attention to the students to emphasize that this is wrong. Because following a scripted intervention program actually could be considered a, part of the using an evidence-based practice piece. So that might be the answer. That the only thing that's going to throw you off and be like, hey, that's not D, is this word verbatim here. Because again, verbatim means that you're not paying attention to the students at all and you're just reading and plowing forward. So the clear, like this is a plausible answer if verbatim wasn't here, but that's kind of telling you it's not. So it's got to be B. All right, we will pick it up after this, and we'll do our very last video and talk about the open response questions. So I will see you there.